Today was a really wonderful meeting, first of all, because we try to unite the patient and scientific voice in one place and how to proceed to tackle the biggest, let's say, gaps and challenges in the future. Take-home messages from here that we are coming united in one voice, patients and scientific community, which can provide a lot of information who will change the landscape for the future in Europe.
So modifiable risk factors such as obesity, smoking, and alcohol consumption are known to contribute to half of all digestive cancers. It's really important that we reach individuals with this preventative message as early as possible. And the best way to do this is to have a collaborative effort with patients and clinical insights that come together to raise patient awareness.
It is important to go step by step, starting from families. I think the communication between parents and kids is so important today. Sometimes there is really no way that the parents tell their kids what to do about the prevention, about everything, but alcohol in particular is an issue. Then we have the role of school, and also teachers should be involved in this. It's not really the knowledge. The adolescents today know nearly everything throughout the social media, but the education is different from knowledge. And I think then only for probably the secondary prevention, us as medical doctors can really play a role. But it's important that we start when they are young and when they can really avoid the first drinking.
Well, I'm a pediatrician, therefore early diagnosis is quite an important issue because that may impact on quality of life, but also on growth and development and adaptation to disease. So I would say that the main challenges that patients face is sometimes medical awareness and general population awareness about some of the diseases. So they need to interact closely with the medical professionals, but also be informed about the conditions that may impact on their future quality of life and health. So I would mostly stress on that.
The diagnosis is a very important moment of not only the life of the patient, but also the family. So a delayed diagnosis, when the symptoms are having for more than years, 1 year or several years, makes a very big effect to the patient's life and the family life. So that's as soon as possible the right diagnosis can be done. That's very, very helpful and important for the whole family and the whole society.
As we spoke about today, early diagnosis can be particularly challenging for patients impacted by multiple international diseases. And we also talked about due to these complexities, it can take an average of 2 to 4 years after the onset symptoms for a patient with IBD to receive a diagnosis. That's a long time waiting for a diagnosis. The long time without a diagnosis increase the burden of this disease. And not at least the value of life or the lack of quality of life quality.
We have today talked a lot about quality of life. And in the Danish Liver Association, we work a lot with stigma. Because surrounding the liver disease, you are stigmatized. So we have a significantly negative impact on an individual's quality of life. And we want to combat the stigma by continuing to advance to educate the doctors in whole Europe, because then they must know more about how they stigmatize their patients, and it's not so good.
So from the medical perspective, I think that working towards reducing the delay in diagnosis, because this will lead to improved outcomes, I think we also need to work towards implementing multidisciplinary teams across all digestive diseases that can meet the need for patients' communications, patients' understanding of their diseases, and that can also lead to better implementation of the best standards of care of practice.
The condition of many patients with digestive disease and cancer has a negative impact in their life. The best way to address their need is to have an integrated approach that combines innovative and advanced therapies, psychological support, and awareness-raising program regarding their condition. In this way, we can ensure them to have access to the best resources and care in order to guarantee for them the best quality of life possible.
I think that was a very good initiative, and it's just confirmed what we wanted to have, the collaboration between patient organizations and medical doctors that specialize in different disciplines within gastroenterology. And we touch on all the most common diseases and the most well-recognized association of patients. I think their points were well taken, and we will combine together our expertise as medical doctors and their thoughts as a representative of Patients Association.